Hi, welcome to Solutions for Seniors. I'm Linda Pellerin with the Shepherd Center of Charlotte. We're an organization that works with seniors to try to keep them active and involved in the community for as long as possible. Our guest today is Josh Rimany. He's a pharmacist with Dilworth Drugs, and he is with us today because, seniors always have a lot of questions about their drugs and everything. And how long has Dilworth Drugs been around in Charlotte?
We started in 2008, so we just celebrated our 4-year anniversary.
Okay, well, we're glad to have you here today.
Glad to be here.
So some of the things, what is the first thing a senior should know about prescription drugs? I know it's a really general question, but...
Yeah, I guess that is a pretty generalized question. In my opinion, the seniors population is so well in tune with taking medicines. They've gradually taken more and more medicines for a long period of time. So I think first and foremost, I guess the best educational thing that they should really take home and they need to know on a day-to-day basis is what they take and why they take it. A lot of times I'll get seniors that will just get used to taking so many things that they almost get confused of what their prescriptions are actually for. And if I had to give my top list of what they should be doing, that would be the number one thing, is to know what they take and why they take it. The why is very important for seniors, because if you don't know why you're taking it, there's a real hard way to see if their outcomes are improving or not.
Well, and it's interesting that you bring this up, and I mention my parents a lot. My parents live in Vermont. They're 87 years old, both of them, and I talk to them every day just to see how they're doing, and they're both okay considering their age. But especially my mom, when she goes to the doctor and he prescribes something for her, she just runs to the pharmacy and gets it filled, and so I'll ask her, and she'll say, oh yeah, well, I went to the doctor for whatever, and he prescribed something for me, and so I ask her, I said, well, what is it? Well, I don't know. And what is it for? Well, I really don't know. And I'm concerned because I'm worried that maybe the doctor, because she goes to several, maybe they're not talking to each other, and maybe this new thing that he gave her, which might be just for like an ache or pain that she has, will interact with something that she's already taking. So is it possible for a senior to come to Dilworth Drugs and maybe bring all their medicines and see if everything jives with everything else?
Oh, absolutely. That's what we as clinicians and practicing pharmacists are, that's our job. That's what we're supposed to be doing on a day-to-day basis. You said that your parents, sometimes go to the physician's office and get a prescription. Well, it's a key point to kind of remember that hopefully your parents are going to one pharmacy too, because of the multiple physicians and multiple prescriptions. If you don't go to a singular pharmacy and you're getting it because it's a convenience or something to that effect, then nobody's really coordinating the care for all of the prescriptions. So it can get even more confusing. So if the patient is going to one pharmacy, you're getting to know your pharmacist, which we strive for very friendly, personal service. We want to know Mrs. Smith coming in every day. But if she does get that prescription that may interact with something a different doctor gave, we can intervene right there before there's an adverse event or a medication error or problem going on with the patient.
Okay, interesting. That is a good thing. Now, is there? I'm sure I'm not saying this right, but is there like a national database where pharmacists can all go to that and pull up, let's say, my mother's name and find out what she's taking?
To date, there is no comprehensive electronic medical record. A lot of physicians' offices are getting involved, so the big hospital systems like Carolinas Medical or Presbyterian, they're adapting these electronic medical records where if you go to one doctor within the whole umbrella, they're seeing the different medical things going on in different cases. Right now, there is no centralized database for a pharmacy, mostly due to competition within pharmacies. But then, that being said, whether a patient gets all of their medicines at one place. If they did want to consult with a pharmacist, they could take all of their medications physically. We call it a brown bag event sometimes, where they gather everything they're taking, supplements and prescriptions and everything, and they bring it to their pharmacist, and we can still log everything in and see what's going on from a total standpoint.
Okay, well, you mentioned supplements, and that's something else too. A lot of seniors are health conscious, and they take a lot of different supplements, thanks to some TV programs. I'm not going to mention one I watch, and honestly, I'm so confused now because, take this for anti-aging, take this for, all these other things, and because it's a supplement, many of the seniors don't think that it's going to interact with their prescription drugs. So, so do you think it's a good idea for pharmacists to maybe ask, what kind of supplements are you taking along? Like,
absolutely.
Let's say somebody comes in with a new prescription and you fill that, should pharmacists say, okay, this might have an adverse reaction to maybe vitamin C or something, or ask them what they're taking as a supplement?
Well, that's a good point. Is there's a two-folded side to that. Is one, all the supplements can interact with your medications, negatively and positively, and two, medications can deplete nutrients in certain instances. So if you have a medication that depletes a certain vitamin, vitamin C or vitamin D is a big one too, you may actually be taking a medication that needs supplementation. So pharmacists are definitely there to kind of guide the seniors, and also stress with them to make sure that their doctors are also aware. I always tell my patients when they come into the store, oh, should I be taking this? I saw this on Dr. Blank's television show, and it happens every day, almost every week when something like that comes out. People are very interested. And I say, well, if you start this, we do an interaction check for anything to see if it counteracts with some of their medicines, like blood thinners or something to that. But then I always say, please tell your doctor that you're taking this, because they want to chart that too, just because if it's not charted, nobody knows what's happening, and maybe down the road something might happen and we won't really be able to figure something out at that point.
Now, does your drugstore carry some of the lesser known supplements? For instance, the other day I was watching a program and they were touting green coffee bean extract, which is pretty obscure in my way of thinking, but do most drugstores carry stuff like that, or do you have to go to a health food store for that?
We carry specific vitamin lines a lot of the times, because a nutrient or a nutraceutical is kind of a new buzzword for supplements. A lot of them aren't scrutinized by the FDA, and they have disclaimers on their bottles that say we have not been proven to be safe and or effective for this outcome, even though somebody might say this works well for you. So you have to be very careful. So me, as a business owner, pharmacist, I want to be very, very certain that whatever we're carrying is going to be safe and carry a lot of scrutiny. So we carry a retail vitamin line that's for professionals only, so they can't be bought in big box stores. It's by the name of Vinco. It's a brand that I have a lot of confidence with, and we do a lot with because I see good outcomes from it. But those interesting little kind of quirky things, we have wholesalers that we can say, so if you came in or a patient comes in and says, I want that, green coffee extract of something, and we'll say, well, hey, let's see if we can find it. If we can't, we refer and tell them where they can find it.
Okay. Now, many of the seniors, well, most seniors that we work with, and I know, so I'm basing this comment on that, a lot of them have a fixed income, and they're worried about medications, and they're worried about the cost of it, and maybe they have a supplemental plan that doesn't cover everything. And so a lot of them are computer savvy, and they go online and they get drugs out of Canada. Is that a good thing?
My feeling is it's a very scary thing. A lot of the online sourcing is very, very dangerous, only to the fact that, yes, maybe perhaps some of them are getting it from Canada, which has fixed drug pricing through their government, which we in the United States don't have. And yes, our medications are very expensive. So seniors are looking for ways, and I hate when I see it, because they're striving, they want to take their medicine, but if they can't afford it, it's, do I take my medicine, or do I eat this week, or do I go to the doctor, or can I afford, clothes or something to that effect? And they'll reach for sources like online Canadian pharmacies. The problem is it's unregulated, and they did a study out that says that almost up to 20% of the medications that people order online are not coming from Canada and can be counterfeit, which means they're actually less potent or not potent or dangerous. And because it doesn't go through the channels that we do to buy the medications to dispense, I always just try to stress with my patients, let's try to figure out another alternative that might be a cost savings opportunity for you so you can afford it through the right channels, which we as pharmacists, we do quite a bit of time. There's a new kind of terminology that's running out there that's called medication therapy management, and it's basically a tool that we use for mostly seniors now. A lot of Medicare D covered plans are covering this, where it's a one-on-one session. So a patient comes in and sits down like we're talking now for 30 to 45 minutes about their medications, and we look for interactions. We look for ways to save them money. Maybe there's a duplication in therapy because Dr. A prescribed one thing and Dr. B prescribed another, and then nobody ever thought that they would figure it out. So we can do a lot of those things to save patients money, even therapeutic interchanges with maybe a pricey brand name drug where a generic's available that's similar, not exactly the same, but gives them the same outcome. And we've done those things that have saved seniors hundreds of dollars over the year.
Now, with Medicare, many seniors have the prescription Part D drug plan, and the Shepherd Center is actually a seniors health insurance information program counseling site, and we just finished up with open enrollment. And the question I have is, can you, as a pharmacist, recommend to a senior when you see that, because I'm sure you see all of the different plans for prescription Part D, and if you see them on maybe they're on a certain plan and maybe they're paying, more money than maybe another plan based on their drug usage, can you kind of, give them a heads up and say, you know what, next time open enrollment comes around, maybe you need to look into this because this may not be the most efficient, cost-effective plan for you?
Yeah, we actually, when I started the store 4 years ago, we wanted to make sure, because that the patients that were enrolling in Medicare D, because they are allowed to enroll once a year, that they were coming up with the best plan, because there's 40 different plans just in North Carolina alone, and a senior citizen may or may not have the savvy to understand which one's best for them to enroll with, especially when all of those plans have people marketing their plans, trying to get the seniors to enroll in a plan that may not be the best for them. So we actually provide that service to anybody that wants it during enrollment period, where we take a look at each and every one of their medications side by side, and we look into the Medicare website and we see which plans work best. We can't, by law, say this is the best for you, but we can give them, here are your options, and this is what we see, and this is my professional opinion. So we aren't beneficiaries of Medicare D, so we can't enroll them, but we can certainly guide them into the best solution for them. And a lot of times when we do that, we do come up with some of those medication therapeutic interchanges that might save them a lot of money. When we probably do maybe close to 100 a year for patients that want it. So and it's for our patients, it's free of service. So it's a service that I've been surprised because we're like, oh, I like my plan, let's just keep it. And then we go into the next year and everybody's plans change, and we've saved patients $600-700 a year.
Wow.
Just by doing that.
Yeah. And, I should stress too that, because we are a SHIP counseling site, we do know that the plans change every year, and actually seniors can come to us, anytime during the year. It's just during open enrollment, which this year was October 15th to December 7th.
Right.
That's when you can actually change plans, unless you have a plan that all of a sudden, is not accepted by Medicare anymore, or where there were changes. Then you can come in and change it anytime during the year. Let's talk about immunizations. I know it's December. I know, hopefully seniors have already gotten their immunizations, or at least the flu shot. But you can, starting going into 2013, if you haven't gotten your flu shot, it's not too late, is it?
No, it's not too late. Seniors 65 and up, everybody, unless you have a counterindication of egg allergy or you've had an adverse event to the flu shot, should get the flu shot. They're the most susceptible to deaths and all the things that can go wrong with getting the flu. So it is not too late. Charlotte is generally later in the year anyway with their flu season.
Is this because we're in a warmer climate, or?
It's just shifting of different things, but since I've been practicing here, we've generally had a flu season that's in the late January, February time. So we're in December. If the senior hasn't had their flu shot, there's probably still a lot left out there. I would definitely recommend that they get vaccinated. Okay,
from the day you get your flu shot, when does it actually kick in and become effective?
It takes about 2 weeks to get immunity and to get the antibodies built against the strains that are within the flu shot.
Now, going back to an experience when my dad had this year, he got shingles. Mm-hmm. And at 87, he had a lot of suffering with that. And it was funny because almost as soon as he got it, then I started seeing the signs up for a lot of the pharmacies going, we have your shingles,
right.
shots.
Yep.
And I hadn't seen them before that. And every day I'm talking to my dad, and he's going, "Oh, I'm just miserable. The pain is just really bad and everything." So, but with the shingles shot, you can get that anytime, right?
Yes. Pharmacists in the state of North Carolina that go through the certificate programs can vaccinate for influenza or the flu, pneumonia, and the zoster, which is the shingles vaccine. That can be given at any time. The Centers for Disease Control's recommend it for every senior 65 and up. It's a manifestation of the chickenpox, and anyone 40 years or older, 99% of us have had chickenpox, whether we think we did or not. Mm-hmm. So it's a dormant virus that can spark at any time, but when seniors that might be a little more immune compromised, or even ones that have diabetes or some other underlying condition, are very at risk to developing shingles. The virus itself can be treated, but like you said, that pain, they call it post-herpetic neuralgia, is very painful and can exist for up to 6 months or a year even after the virus is eradicated with medication, and it is very painful and very uncomfortable. And I know by experience, only because that's ironic that you said that. I'm 37 years old and I had shingles a month ago. So I'm going on a big campaign to vaccinate everybody that needs it. And all Medicare D drug programs cover the Zostavax vaccine in some form or another. Some cover very little, some cover it 100%. So we definitely urge our patients to get vaccinated.
Well, and it was funny because, I checked with my mom and I said, you need to go get this shot, and she said that she had checked with her doctor and they said that she didn't need to. And I'm like, and I don't want to say anything against doctors in Vermont, but I think the ones in the Charlotte area are more knowledgeable.
Like I said, I know from personal experience, it's very uncomfortable. If it's something, and the Zostavax vaccine doesn't prevent it 100%. It's about a 50% coverage. Mm-hmm. But if you can eliminate 50% chance that might get a viral infection that is could be extremely uncomfortable and painful. We're not just talking, a minor soreness. It's your shirt touching the lesions could create magnitude of pain. So even just wearing clothes could be painful. I feel for seniors that when they get that, because even if you're vaccinated, that pain from the shingles, the post-herpetic neuralgia, is lessened. They've shown it. So even if you did get the shingles, you could actually feel less pain just by getting vaccinated.
Right. Now the pneumonia shot, I see a lot of advertisements for that too.
Mm-hmm.
Now, if you get that shot, do you have to get it every year?
No, it's unlike the flu vaccine, which circulates every year, and our immunity wanes every year because the flu virus is very smart at changing every year. It's been around longer than us, so it wants to stay around. We have to cycle that every year as a shot. The pneumonia vaccine is a 23 valent vaccine, which means there's a bunch of different strains for different types of pneumonia. Seniors that have gotten one before 65 only require one shot, which covers them for an extended period of time. There's some instances where they might need a booster 5 years down the road, but it's something that we try to remind seniors when we're doing the flu shot every year. That's just one question we always ask. Do you remember, or when was the last time you had the pneumonia vaccine? Because that's the one that gets forgotten because it's not every year.
Right.
And if they can get vaccinated for that, that's just as complicated and potentially dangerous as the flu.
Now, and is there like an incubation period for the pneumonia shot and the shingles shot once you get it?
Well, generally speaking, what's convenient about asking someone during the flu shot season or at any time is you can give the flu shot and the pneumonia shot in the same time. With the zoster vaccine, you have to wait 4 weeks because it's a live vaccine. So, but all relatively speaking, takes around 2 weeks for the immunity function to start building.
Okay. We're getting ready to wrap this up, but I want to ask you about the osteoporosis drugs.
Okay.
I've heard a lot of different things about them, in that that maybe they're not what they claim to be, that maybe they're causing bones to become more brittle. And that, let's just take Fosamax for instance. I took that for 10 years and still had broken bones. So I finally quit taking it, and I'm just taking like extra D and extra calcium and everything. And I have doctors that they call me. Okay, you need to come in for, they wanted to put me on the reclass shot, and I'm like, oh yeah, because I want to have an IV, and once it's in my system, I've got it stuck there for a whole year. I mean, what is the pharmaceutical industry or pharmacies? How do you feel about that from your end?
My patients that come in, because it's a great question, they're scrutinizing these drugs a lot more. Let's just take Fosamax. It's one of what they call a biphosphonate drug. That drug class in general has had some instances of femur fracture in patients that have taken it over an extended period of time. So a lot of people that are taking these medicines to potentially strengthen their bones or reduce their osteopenia or osteoporosis risk to improve their bone density are kind of scratching their heads sometimes, and they're saying, well, I saw this on the news. Why would I take something to strengthen my bones if it's going to cause my bones to fracture? So there's more scrutiny now. Does the benefit outweigh the risks? Because the risks of those fractures are very small, although they can happen. But the benefits sometimes, if the patient is looking at with their doctor, it says you're at a very high risk of osteoporosis and spinal fractures or spinal compression, which can cause a lot of pain and a lot of discomfort, or hip fractures, or the things that we're susceptible of when we have osteoporosis. So the doctor now has to look at it from a different perspective, because there are some long-term side effects to some people that take it. So I always tell the patients, discuss it with your doctor, look at the other alternatives, make sure you're doing the other things, because if you take any of these drugs for a long period of time, like you said, they do stay with you. They absorb into bone, they don't just flush out of the bloodstream, because that's where they work. So I've actually had a patient that broke both her femurs on different occasions because of Fosamax. But I've also had hundreds of patients that have taken it that have done just fine.
Well, and I know there's a school of thought out there that says that osteoporosis was just a disease that was made up by the drug companies to sell things like Fosamax.
I hear that a lot about all sorts of things.
And everything like that. So, we're getting ready to wrap up here. Is there anything that you would like to tell the seniors specifically, as we're heading into the new year?
The number one thing I can, from my perspective as being a practicing pharmacist for so many years, is to get to know your pharmacist. Find a pharmacy that's near you, that's going to give you the time to get to know you as a person, because if you know your pharmacist, you know that they're going to be more active in taking care of you and giving you that positive approach to working with your physicians and looking at those things. That's why we started the business. I left the big box chain retail settings. It's not to say that you can't find good pharmacists there. We have lots of good pharmacists in this country. But when you get to know your pharmacist, you really, really get to increase your outcomes, save money, and you just live better at that time.
We are wrapping up the year, and I appreciate everybody who tunes into us and sees what's going on with the Shepherd Center and everything. We've got a lot of fun things going on starting in January. At the end of January, we have our Adventures in Learning and everything. So I just want to say, happy holidays and happy New Year, and I look forward to seeing you next year.